So the recording is on, sir. We may begin with the session.
Okay. Ragadi-rogan satatanushaktan asheshakaya prasritana sheshan autsukya moha ratithan jagana yo purva vaidyaya namostutas. Welcome to the discussion on Kustha Nidana, the 14th chapter in Nidanasthana of Ashtanga Hridaya. We have discussed some of the salient features like origin of Kustha and its etiological factors in our last session. Today we'll move on to some of the important cardinal symptoms of Kustha. दाह कंडोस्त्वचिस्वापः तोदः कोटोन्नतिप्समः व्रणान् Now, Vagbhata describes the Purva Rupa Lakshanas. Many times these Lakshanas are also with the Rupa. This also appears with the Upashaya and Anupashaya. And also it is each and every Lakshana here has its own Samprapti. But still, these symptoms or these clinical features are suggestive of onset of one or the other skin disease. So he has enlisted some of the most important clinical features we can identify in our clinics on skin diseases. We will discuss one by one. The commentator has not described it in detail because these are all the Lakshanas are described in the earlier chapters of Ashtanga Hridaya. So the first one is Atish Lakshana, Khara, Kharasparsha, Kheda, Sweda, Vivarnata. There are 6 symptoms in the first line. Like Ati is applicable for all these clinical features. For example, when it is mentioned Atish Lakshana, it is also Atikhara, this is also Ati Sparsha, this is also Ati Sweda and Ati Vivarnata. So the word Ati is applicable for all the later features. Then Daha, Kanduhu, Tvachi, Swapa, Todaha, Kota, Unnatihi, Shramaha. Daha and Kandu, they are the cardinal features of Pitta and Kapha. Daha is a manifestation of Pitta. So these Purva Rupa Lakshanas are a collective picture of all the doshas. Because dosha visheshai kushtai, kushta visheshai doshai. We can identify the kushta based on the dosha, clinical features of dosha, and simultaneously by identifying the clinical features of kushta, we can assume the inward dosha in it. So we will have a mixture of various dosha lakshanas and also related with the skin, because there is a controversy that Sushruta says that skin or the twak is the manifestation part in all kushtas, whereas other texts like Ashtanga Hridaya or Charak Samhita, they believe kushta in twak, kushta in rakta, kushta in mamsa, and kushta in meda. While describing the prognosis, when the kushta is in the twak, it is mentioned as a curable. When it is in the later dhatus like rakta or mamsa, it appears to be kritra sadhya. When it is in the meda, it is considered as asadhya. Here we will have a collective features of all doshas. You can see Atish Lakshana, Atikhara, they are the Khara is a manifestation of Vata. Sparsha Kheda, that's a tenderness, that's also a feature of Vata. Sweda, Atisweda, Sweda is Atisveda is a Lakshana of Pitta. Vivarnata is a manifestation of all doshas. Still, the role of Vata is very much important. That the discoloration. Discoloration is one of the most important cardinal feature of Kushta. Kutsnati Vapuhu. So there will be discoloration or the change in the appearance of skin. That is an important Purva Rupa Lakshanas. Daha Kanduhu Tvachiswapaha Todaha Tvachihi Suapaha. There will be some discharges. Tvachi means the skin and apa is the discharges. Todaha, there is a pricking pain. Again because of Vata. Kotha. Udarda Kota, they are all the manifestation of Kapha. Unnata Kota, there will be rashes, they appear like elevated things. And Shramaha, there is a Shrama and Klama, there are these two words. They are related with the feeling of tiredness with some work or without some work. Shrama is the after doing some work, you feel very much tired. Then about the possible chances of getting Kustha, they are mentioned as if these symptoms are present, you should be very careful that there is a risk of developing Kustha in later life or later days. In that way, it's mentioned Vrunanam Adhikam Shulam. There is a specific type of Shula in every Vruna based on its Shuddha Vruna or Dushta Vruna or based on the various types of Vrunas. Here, whatever may be the type of Vruna, the Adhika Shula is a feature of Kustha. Vrunanam Adhikam Shulam. Shikrotpatihi Chirastitihi. Vruna appears very suddenly without much time. Shikrotpatihi Chirastitihi. It will not be healed properly in spite of doing the best treatment. The Vruna will not be healed. It's a Chirastitihi. Rudhanam api rukshatvam. Even if after getting healed, there is a roughness in the selected areas, Rudhanam api rukshatvam. Nimitto alpepi kopanam. Alpepi nimitte kopanam. In spite of a very small trigger, there is a exacerbation or all clinical features will appear once again. All features of Vruna will appear once again in spite of small irritation to the skin or some small internal factors that may produce the disease. Roma Harsho Asrajaha Karshnyam. Roma Harsha will be there and Karshnya will be there. Karshnya is the hyperpigmentation. Krishnata is called as Karshnya. Asrajaha Karshnyam. It is produced from Raktadashti. Kushta Lakshanam Agrajam. These are all the Pragrupam or the Purva Rupa Lakshanas. Then we will go for the classifications. The commentator says, Atishtlakshnadikam Kushtalakshanam Agrajam Pragrupam Ityartaha. Commentator says it's just the Pragrupa. Adhuna etesham lakshanani aha. Now we will describe the proper symptoms. Lakshanani aha. Krishna runakapalabham. Ruksham suptam karam tanu. Vistrita samaparyantam. Krishi tailoma rishitaihi. Rishite lomabhischitam todadya malpakandukam todadyam alpakandukam kapalam shigrasarpicha. He describes the description of kapala kushta, or the first type of kushta. Krishna runa kapalabham ityadikam kapalasya lakshanam. What is a kapala kushta? The word kapala suggests a flat thing, just like a flat bone in the skull. It appears Krishna Aruna Kapalabham. The first feature is it looks like a kapala. Kapala is a flat appearance or round appearance. Krishna and Aruna, it's a slightly blackish or hyperpigmented or slightly swollen or inflamed. Aruna is a feature of inflammation or redness. Ruksham, Suptam, Kharam, Tan. There are four features we can identify. One is the Rukshatva. Ruksha is a Sparshagamya Bhava. Supta is a Manasika Bhava. He says that I cannot find out the sensation here. Suptam. Khara is again a partially Sparshagamya or partially Drishagamya. Tanu is very thin type of uh, circular elevations, very thin. Vistrita Samaparyantam. Vistrita Samaparyantam. Vistrita, it's a spreading or it's actually involves a large area. But Asamaparyantam need not be very regular all around. It's Asamaparyantam. Somewhere it's regular, usually it's irregular in shape. Rishi Tela, Tel, Rishite Lomabischitam. Rishite Lomabischitam. Rishite means during Loma Harsha, Lomabischitam, it's actually covered by Lomabischitam. There is a Romas will be covering, or the hairs will be covering this one. Todadyam alpakandukam. Toda is too much because it's a vataja manifestation. Alpakandukam, there is a slight irritation, irritation is also there. Kapalam, shigra sarpicha, the nature of spreading, nature of enlarging is too very quick. So these are all the features of Kapala Kustha. Then we will go for the next Pakodumbara. Pakodumbara Tamrattvak Roma Gaura Sirachitam. Pakva Udumbara like the fig-like appearance which is already ripened properly. Tamratvak Roma Gaura Sirachitam. Roma, there is a Tamratvak Roma. It's a full word. The hairs will appear like tamra or the coppery in the skin. Gaura Sirachitam. There is a covered by. Achitam means encapsulated or all around. There is a Gaura Sira, white colored Sira. You will be finding some discoloration there. Bahalam Bahalakleda Raktam Daha Rujadikam. Bahalam, it's multiple, too much. Bahalakleda Raktam. There is a discharges. Discharges may be even blood. Or Daha Rujadikam. There is a too much of burning sensation or too much of discomfort due to this burning sensation. Ashuthana Avadarana Krimi Vidyat Udumbaram. Ashuthana, sudden appearance, or Avadarana Krimi, you will be finding the maggots there. Vidyat Udumbaram, these are the features of Udumbara Kushta. Pakvodambara Tamradikam Audumbarasya Lakshanam. Next, we will go for the next Mandala Kushta. Mandala, it looks like a circular or ringworm like. Ring, we call it as a ringworm or tinea. That's mentioned as mandala here. Sthiram, Styanam, Guru Snigdham. It says sthira. It's not actually too much of spreading. It's fixed to one particular place. And Styanam, Guru Snigdham. It is heavy or it is snigdha or shining in appearance. Shweta Rakta. Manashugam, Ashugam, Shweta, Raktam, anashugam. Immediately it will not spread. It's white colored or red colored. Anyonya saktamutsannam. Sometimes it's joined together. Two types of rings will be joining together. Anyonya saktam utsannam. It's elevated. Bahukandu Shruti Krimihi. There is a too much of irritation or itching, and Shruti Krimihi. There is too much of discharge. Shrutihi. Krimihi. There is a appearance of maggots or other pathogenic organisms. Shlakshna Pitaba Pariyantam. Shlakshna shining. Pitaba Pariyantam. It's a shining yellow in color. Mandalam, Parimandalam. The classical characteristic features of mandala is the Parimandala. It's a circular in appearance. Mandalam, Parimandalam. Stiram, Styanam, Ityadikam, Mandalasya Lakshanam. Commentator has not commented much. Then, Vicharchika. Vicharchika is mentioned as Sakandu Pitika Shava. There is an itching, there is a blisters, Shava, it's a hyperpigmented. Lasikadhya Vicharchika. The classical feature is Lasikadhya Vicharchika. Lasikadhya is there is a discharge of serum. There is a too much of discharge. That is called as Vicharchika. Everywhere we will be finding one specific one word classical importance of the every type of Kustha or Mahakusta. Then we will go for the Rikshajihva, Rikshajihva. It's also called as Rikshajihva or Rikshajihva. Parusham Tanu Raktantam Antasyavam Samunnatam. It's elevated Samunnatam. Antasyavam, inner portion is shava or gray color or hyperpigmented sometimes. Parusham is very rough in appearance. Tanu, thin. Raktantam, inside there is a blackish, and outside there is a raktantam. Edges are all red and inner portion is black. Sato dadaha ruk kledam. These are all the features of daha, toda, kleda. These are all the tridosha lakshanas. Daha or ruk or toda and ruk related with vata. Daha related with pitta. Kleda related with kapha. Karkashaihi pitikaischitam. Very rough pitikas. Karkashaihi pitikaischitam. Riksha juhvakriti proktam. Riksha juhvam bahukrimihi. There is a lot of krimi in this particular riksha juhvakritihi. Riksha juhvakriti is the appearance. Parusham ityadikam rikshajihvasya lakshanam rikshajihveva prakashakara akritiryasya rikshajihvasya tathaivam. It is a prakashakara. This is illuminated but still rough in appearance. That's called as rikshajihva. Hasti charma karasparsham charma. Charmakhyam or charma kushta is hasti charma. Just like elephant skin, it is karasparsham for touch. It is very rough, kara. Hasti charmot karasparsham charmakhyam kushtam charma kushtam. Next, ekakhyam mahashrayam asvedam matsya shakala sannibham. Next, this one is Matsya Shakala Sannibham. Ekakushta is having Mahashraya. It's very much deep seated. All the underlying tissues may be involved. Asvedam, there is no too much of burning sensation here. Matsya Shakala Sannibham. It's a skin. Skin appears like the skin of the fish, or there is some shining appearance, there is a dotted line, all these things will be there. Commentator Sarvang Sundara describes with more details. Ekasamjam kushtam mahashrayam vistirna. Vistirnashayam, its ashraya is vistirna, or its seat or the location is expanded. Tata asvedam sweda rahitam tata matsya shakala sannibham. Matsya Tvak mandala sadrisham, just like a fish's skin. Sushrute tu ekakushta sevam lakshanam abhyadayi. Sushruta Nidana, 5th chapter, 9th sloka. Ekakushta lakshanam abhyadayi. Kritsno dehe deho yasya raktoruno va tadekakhyam kushtamahu sukashtam iti. Arunadatta has given the cross reference of Sushruta Samhita, which is somewhat different here. See, Kritsno deho yasya raktarunova, entire body becomes, entire skin becomes rakta or arana, red colored. Tadekaksham kushtam ahu sukashtam. Whereas here, the appearance is mentioned as Matsya Shakala Samibam. Whereas Sushruta has mentioned it, Rakto Arunova. So there is a difference. That's why Arunadatta found that it should be mentioned here. Karanada Samhita is also mentioned. Mahadasvedanam Matsya Shakala, Matsyak Shakalakaram Ekajam. Karanada Samhita has mentioned the same thing as in Vagbhata, or Vagbhata has referred this one from Charaka and Karanada, not from Sushruta. Charaka and Karanada have given a similar description. Now Kitibham Punaha. Kitibha Kushta. Ruksham urdhvakaye syat. Usually it is in the upper body, upper extremity. Karanade pyuktam ala abu pushpavat siddham grishtam yacha Dvamed Rajaha. Grishtam Yacha Vamed Rajaha. It discharges or vomits the dust. That is the description in Karanada Samhita. Karanada Samhita is not available now, so we have to depend upon these such commentaries to have the opinion of Karanada. Next, Gandaihi Kanduyutaihi Chitam Raktehi Alasakam. Alasaka is a type of Kustha. This usually appears in the Ganda or the cheek portions. Kanduyuta is Chitam. It's always with the irritation or itching sensation or scratching sensation. Raktehi, it is produced from Raktadushti. Raktehi. Commentator says, Alasakam nama kushtam gandaihi raktavarnaihi kandujitaischa vyaptam bhavet. It spreads like raktavarnaihi, red color. Then comes the vipadika. Vipadika is the pada. Pada is appears to be plantar. V means visheshena padaha. That means the normal skin of the pada or the plantar surface or the soles are not there. There will be something vishesha. That means fissures. Fissures is the vishesha there. Pani pada daryo vipadikaha. Pada daryo vipadikaha. So either hands or the soles, there will be cracks or the fissures. Dharana is the cracks. Vipadika. Tivrartyo, that's highly painful. Manda kandvascha. Itching may not be there, but it's highly painful. Saraga pitikachita. There may be redness when it erupts or when there is a cracks. It may be surrounded by pitikas. There may be red colored blisters. Commentary says, Vipadikaha panipada daryah syuhu. So Vipadika is the cracking of pani and pada or the hands or the soles. Tata tivrartyaha atyanta pidaya yutaha. Tata manda kandva alpa karjukaha. He has used the word karjukaha to indicate the itching sensation. Tata saraga pidikachita. There is also redness and blisters. Panipadau darayanti iti karmanyana tan iti. So the person is not able to do the karmas or these are the jnana or what you call indriya, karmendriya. So akarmanata, the karmas related to the hand and the legs may not be possible. So he has mentioned karmani and akarmanata is also possible. Next is the mandala. Dirgha pratana durvavad atasi kusumachavihi utsanna mandala dadruhu kandumat anushangini. Anushangini is actually relapsing type. So description of dadru. Dadru is dirgha pratana. There is a full extension or the long extension. Durvavat atasi kusumachavihi. Just like durva plant, grass, that grass, durva, appears like a durva with dirgha pratana. Durva has a long extending stem. Similar to that one, dadru is also there. Atasi kusumachavihi, shining like atasi kusuma. Utsanna mandala, it's elevated and circular in shape. Dadru, Kandu, Mat, Anushangini. We will see what the commentator has mentioned about Anushangini. Durvavat Dirgha Pratana Dadru. Tatha Atasi Pushpabha. Tatha Utsanna Mandalacha. Tatha Kandumati. Tatha Anushangini Prasakta Anuprasaktya Samshleshavati Shariram Anuthavati. So, in spite of getting a cure, there is a risk of developing it again and again. The relapsing type is a speciality in Dadru. He has given three examples, three similes for Dadru. The first one is just like Durvankura, this is Dirgha Pratana. It is a long. Second, he has given the shining appearance of Atasi Pushpa. Third one is mentioned Utsanna Mandala, there is an elevated mandala like. So these three examples are given. In addition, the nature of the disease is also mentioned as Anushangini, or always relapsing in nature. Shataru. Shataru is the multiple. Shata Aru. Shata is 100 or multiple. Aru, there is a blisters of 100 times, 100 in number or multiple. Stula Moolam Sada Harti Rakta Shavam Bahuvranam. The major part in Shataru is क्लेद जंत्वाढ्यम प्रायशः पर्वजन्म च prayashah parvajanma cheti. That means in the parvas or in the metaphalangeal regions, in the interphalangeal areas, there is a risk of developing this one. Stula moolam, it says deep-seated. Sadaharti, there is a burning and pain. Rakta shyavam, color is rakta or shyava, gray or red. Bahuvranam, there is a multiple ulcers or multiple wounds. Shataru, kleja jantvadyam, there is a discharge as well as the maggots or pathogenic organism. Prayashaha, parvajanmacha. Usually it appears in the interphalangeal regions. So Sarvanga Sundara says, Shatarur nama kushtam stula mula dilakshanam yavat prayashaha parvajanmacheti. So in the parvas it appears. Next, Pundarikam. Pundarika is the red colored lotus. Raktantam Antara Pandu. Outside it is a Rakta, Antara Pandu. Inside it is a, what you call, pale color, pale white or yellowish white. Antara Pandu. Kandu Daha Rujanvitam. All symptoms of doshas. Kandu is there, Daha is there, Ruja is there. Kandu Daha Rujanvitam. Sotsedam achitam raktaihi. Utsedam achitaihi raktaihi. Utseda is that there is elevation and covered by rakta or red color. Padma patram ivam shubhihi. Padma patram iva amshubhihi. Amshu is the vase. Just like Padma patra or the it's covered by or encapsulated by Padma patra, like here Padma patra appear can be described as not only lotus leaves but the petals of lotus. Padma patra ivam should be lotus petals, red in color. Ghana bhuri lasika strik prayamashu vipedich. Ghana, it's hard, it's a thick one. Bhuri lasika strik. There is an excessive discharge of lasika and rakta. Asrik prayam ashu vibhedicha. It also highly painful. Pundarikam. This is called as Pundarika. We'll see the commentator's opinion. Pundarikam nama kushtam raktaparyantam tatha antara madhye pandu tatha kandudaha rujayutam tatha unnati yuktam tatha rakte ramshubhihi sukshma rekhabhihi achitam vyaptam rakte ramsha amshubhihi, red colored amshubhihi, sukshma rekhabhihi. Amshu refers for the sukshma rekha or the rays or the lines of minute. Achitam vyaptam covered, padmapatram tatha ghanabhuri lasika srik prayam ashuta vibhedi. Immediately it's a painful. Simultaneously, when the Pundarika Kustha appears, patient will have severe pain. Tanutvag bihi. Tanutvag vischitam spotaihi sitarunehi vispotam. Vispota is the blisters. The blisters will be very thick in skin, thick colored skin, tanutvak, bihi chitam spotaihi, sitarune. It may be red color, Sitarunaihi Shvetalohitaihi. It appears like, it looks like Shweta and Lohita, red or white colored small blisters. Pitika, Pama, Kandu, Kleda, Rujadika, Pama, Pambi, Kandu. There is a severe itching, severe discharges, and the pain with the blisters. Sukshma, Shavaruna, Bhofyaha, Praya, Spik, Pani Kurpari. Again, the word Pama is mentioned a specific location. For many of the skin diseases, even in the modern dermatology, they have a specific locations of spread. Some of them are appear only in the face, some only in the axillary region, some only in the groins, some only in the hands, or some only in the legs. So here it is mentioned, spic Pani kurparaihi. Pani in the hands or in the kurpara sandhi or in the spic in the back. These are all the prayaha. These are the common locations of pama or eczema or the scabies. Sukshmaha shavaruna bhapvyaha. They are multiple. They are gray and red color. So commentary says, Pitika Kandu Kleda Rujadikaha Pama Ityuchate Kimbhutaha. The blisters of irritating, itching, and discharging, they are called as Pama. How they appear? He answers. Sukshma Shavaruna Brahbhyaha. They are very minute or gray and red color and multiple. Prayo bahulena sachapama sachapama spijoh panyoh kurparayoscha syat. There are only 3 exact locations where you will be finding pama. Next, charmatala. Sparsham or sparsham. There is a very severe tenderness. There is Kandusha, Toda, Usha, and red colored, and that's called as charmatala. Charmatalam nama kushtam spota vattata sparsha. Syat. Spota is putanam. We'll go for the next disease. Kakanakam. Kakanam tivradaharuk. The first line itself he has mentioned among all these diseases, very severe pain and burning sensation is seen in Kakanaka, Kakana Kustha. Purvam Raktancha Krishnancha Kakananti Falopamam. It looks like Kakananti Phala. Kakananti Falopamam. Purvam, initially, Raktancha Krishnancha. Red colored and black colored. Kushtalingair yutam sarvaihi ekavarnam tato bhavet. It may be Kushta lingair yutam sarvaihi. All symptoms of skin diseases may be present here. Ekavarnam or tato bhavet. It may be single color, single discoloration. Kakanam nama kushtam tivradaharuk. Tata Purvam Prathamam Raktam Tata Krishnam. Initially it's red in color and then becomes black. Kakananti Falopamam Gunja Falasadrisham. Commentator has mentioned Kakananti is the Gunja or abject pectoris, or the what we call one color red, and in the middle there is a black, fully red and black dot is there. It's a Gunja Phala Sadrisham. Tata Anantaram. That's why Purvam Raktam Tata Krishnam. Initially red color and in the middle there may be black color, or initially red and then it turns into black. For this one he has given the Gunja Phala Sadrishyam. Tata Anantaram Sarvaihi Kushtalingay Yutam. All features of Kushta. Naika Varnam Apitu. It may be multiple in color. Na ekavarnam, naikavarnam. Apitu shweta pitadi varnam api syadityarthaha. It may be not only red and black, but it may be pita or shweta or any other color. Any other color may be present. Sushrutetu mandala shataru vipadika alasaka charmadala vispotakakyani noditani. Sushruta has not mentioned these diseases like mandala kushta, shataru kushta, vipadika kushta, alasaka kushta, charmadala kushta, and vispotaka kushta. These are 6 or 7 are not mentioned in Sushruta, whereas Sushruta has included them, some of them under Ksudra Roga. Stula, Arushka, Maha Kushta, Pari, Sarva Visarpa, Visarpaha, Visarpa, Rakasarunakhyani, Tatra Uktani. He has added some other diseases. These are the additional diseases mentioned in the Kushta by Sushruta. There is a Tatroktani. Evam Chatallakshanam. Commentator has provided the additional kushtas after describing all kushtas of Vagbhata. He has provided a list of additional diseases mentioned in Sushruta. He has provided exact references. Yatra sthula mulani arumshi jayante sandishu ugrani tat stula arushkam kushtam. Stula arushka kushta is described in this way. Utpadyante sarvadehe mahakyam tvak sankocha swapa todanga sada sadaha toda anga sadaha yasmin dirga spotika sravavatyaha sam sarpaihi yustam parisarpamahuhu. Parisarpa or visarpas lakshana is mentioned. Tulyaha sarpo sarpaidyo visarpena shigram tvagraktadin vyapya sasyad visarpa. Just like a sarpa or the snake, it immediately spreads into tvagraktadi dhatus, that is called as visarpa. Kritsne dehe spotika sravahina kandu praya raktasasta pradishtaha arunani tanuni visarpini tapayutani aruna kushta's description. Tad eteshu kushtamedeshu yata nama viparyayaha tatha lakshana viparyayo api kintu etepi kushtabhedaha drishyante eva ityetadapi lakshanam adaraniyam iva iti manyamahe adhikam kushteshu ityadi. He has provided some other diseases similar to kushtas mentioned in Vagbhata. Now we will describe the next level of prognosis. Kushteshu trideshu jeshu satsu idam vatadikam kushtam idam pittadikam kushtam idam kafadikam kushtam iti katam jnatavyam ityaha. Because all kushtas are produced from all doshas. There is no kushta produced from ekadosha. So every type of skin disease is the result of all three doshas. Then why we should say vata or vata pittat, vata kafas, tridoshat, these kushtas? This classification appears to be not incorrect. At that time, Sushruta, Vagbhata has mentioned, Dosha Bediya Vihitehi Adishet Linga Karma Vihi. Though in all skin diseases, in all kustas, all doshas are involved, the dominance of dosha that should be considered, and accordingly we should say this is vatadika kushta or pittadika kushta iti. That's why it's mentioned dosha visheshai kushtei kushta visheshai doshai kushteshu dosholbanatam. Which dosha is in ulbana avastha, that's why they are considered as Tridoshada, but one dosha is more dominant among other doshas. This part needs more clarification, hence Sarvanga Sundara has commented in detail. Kushteshu doshol doshadikyam doshabediya vihita yathayatam linga karma bihi adishet. According to the dominance of dosha, as mentioned in dosha bedi adhyaya, what happens in vata increase or vata pitta increase, and accordingly you will be finding the difference. Lingani cha tani karmani cha linga karmani. His linga is the symptoms, karma is the functions. Both are mentioned in Kustha. Vayo samsadini, pittasya dahadini, श्लेष्मणः स्नेह काठिन्यादीनि यथायत् यथायथम् आत्मीयैः एव कर्मभिः यस्तेषां लिङ्गं लक्ष्यते ततस्तेषां दोषाणां कर्माण्येव लिङ्गान्युच्यन्ते. So in vata there are specific symptoms. Pitta there is a burning sensation. Kapha there is a snigdha guna increase or kandu and all these things. So we should identify these symptoms and trace the dosha involvement and the dominance of dosha in those diseases. Atayeva sramsadini karmani doshanam अशेषि यदुक्तं दोषलक्षणं दर्शनाद्यैः अवहितं identify the involved doshas. Sarva dosholbanam tyajet. Now comes the prognostic part. Sarva dosholbanam tyajet. When you find that all the three doshas are increased, irrespective of one or two doshas, then it should be discarded from the treatments. Listoktam yacha yachasti madhya shukra samashrayam, or when there is an arishta lakshana, sristoktam, or asti majja shukra samashritam, asti majja shukra, last three doshas, three dhatus. If it involves last terminal three dhatus, then also it should be discarded. Sarva dosholbanam sannipatajam kustam tyajet na chikitset iti ristoktam iti yacha vikriti vijnaniye kathitam. This Vikriti Vijnaniya is mentioned in the Sharirasthana Adhyaya, 5th chapter, 98th sloka. Kushtam Vishirya Manangam Itya. There is a sloka of Arishta Lakshanas in Kushta. If they are present, it should be discarded. Tacha Nopakrame Ityacha Kushtam Asti Majja Shukra Samashrayam Tacha Tatyajet. These should be of very poor prognosis. Yapyam Medogatam Medogata Kushta. He has mentioned Asti Majja Shukragata is Asadhya, Medogata is Yapya, Medogatam Kushtam Yapyam, Patyadebihi Yapitum Shakyam. If you ask, if the patient follows all Patyas, it is controllable. Kritram Pitta Dvandvasra Mamsagam. Kritra Sadhya is Dvandva Pitta Dvandva Sama Astra Mamsagam. Rakta and Mamsagata, or Asrik is Rakta, Mamsagata, or Dvidoshaja. If only Vata and Kapha is involved, it is curable. Pittasya dvandvam pittadvandvam pittvadvandvajam tata raktagam mamsagam cha kushtam krithram krithrasadhyam. Next, akrithram. Which are the akrithra? Which are the easily curable? Sukhasadhya, kafavatadhyam. Pittadvandvam. There pittadvam says pitta kafaja or pitta vataja is krithrasadhya, whereas vata kafaja is sukhasadhya. Kafavatadhyam tvakstam ekam. Ekamalanchayat. If it involves only one mala, then it is sukhasadhya. Kafavatadhyam akrithram sukhasadhyam tata tvakstam tata ekadoshadikam cha yat kushtam tacha sukhasadhyam. Tvachi sthite kushte toda vaivarnya rukshata. Then he describes in brief the involvement of different dhatus in kushta. Skin diseases presenting with the deeper tissues or superficial tissue. This sloka is very important to identify the gravity of the disease. He has mentioned already that tvaksthita or raktashrita is sadhya, rasashrita is sadhya, raktashrita and mamsashrita is kritrasadhya, and above that asti majja shukrashrita is asadhya. We should be able to identify which are the symptoms of this ashrayatva. Tatra tvachistite kushte toda vaivarnya rukshata. Three features like pain, discoloration, and roughness. These are the features of tvaksthita. Sweda swapa shvayatavaha shonite. There will be sweating and swelling or the edema in shonite rakte. Pishite punah panipadashrita spota kleda sandishu chadikam. Panipadashrita spotaha sandhi, the kleda. If there is a panipadashrita in the hand and legs, and also there is a kleda that indicates the pishita mamsa. Kaunya is actually kana or gatikshayo anganam dalanam. Kana is a handicap. Kaunyam. Gatikshaya is the immobility in the movements. Anganam dalanam, the falling of angas, like in Firanga or some of the leprosy, we will be finding a part of the interphalangeal joint is involved and part of the small bone cartilage is fall off. Dalanam syacha medas. These are all the meda dushta or involvement of meda. Nasa bhango asti majjaste. Netra ragaha swarakshayaha. Nasa bhanga will be there. In Firanga, you will be finding the nasal septum that has become degenerated, or asti majjaste. In asti majjara shukra, we will have redness in the eyes. Swarakshayaha. There is a continuously hoarseness of the voice. Kshatecha krimayaha. When there is a part is falling off, you can find the krimis. Shukre swadarapatya bhadanam. Apatya, next generation, his children, his offspring, everyone will be affected by the same disease in case of asti or shukragata kushta. So the last shloka he describes somewhat with more details. Tatra teshu kushteshu madhye tvajiprapte kushte todadaya syuhu. Among them, tvajiprapte kushte todadaya, burning, pricking will be there. Raktaste kushte swedadya syuhu. Mamsaste kushte panipadashrita spota syuhu. Sandishu cha atishayena kledo bhavati. Medasi sthite kushte kaunyam kunita tata gatikshayah tata anganam dalanam chedanam ivasyat. Asti majjaste kushte nasayah granasya bhangaha tato netrayo ragaha swarasya chakshayah syat. Kshate cha krimaya syuhu. Shukraste kushte daranam apatyanam chabadhanam upadravai svedadibihi pidanam syat. So these are all the Dhatugata Kushta Lakshanas. Yatha Purvancha Sarvani Syihu Linganis Srigadishu Iti Kushta Nidanam. Here completes the Kushta Nidana. Yatha Purvancha Sarvani. The commentator says, Asrigadishu Dhatushu Kushta Kranta Dekhanam Naranam Yani Lingan Yuktani Tani Tani Yatha Purvam Syuhu Yatha Svedadati Raktaste Kotha Kothinam कथितानि पाण्याद्याश्रिता स्फोटादयश्च मांसस्ते स्युः एवं मेधप्रभृतिषु योज्यम् एवञ्च स्वेदस्वापादिनि सर्वाण्यपि शुक्रस्ते कुष्टे दाराणाम् अपत्यानां च स्युः इति यथा पूर्वम् Vamshabdasyartha. With this, we will complete our present discussion, and we will continue with our later discussions tomorrow. Hari Om.